Okay, thank you. Hello everyone. We are about to start. So thank you. Thank you all for coming through in large numbers. And once again, we sincerely apologize for the mix-up in terms of the updating the calendar and what was on the flyer. So as a result, some of you ended up logging in a bit earlier than the time when we are supposed to start. So as we begin to, I'll just introduce myself. My name is Anafi Mataka from the African Society for Laboratory Medicine. And I'm so excited with the level of interest that we have shown issues of waste management. This is a key issue that we all agree that we have not yet paid so much attention to. And we need to start moving, particularly with issues of viral load and EID. We are talking of scale up of viral load testing. And in that scale up, we also mean that we are also increasing the amount of waste that we are actually producing. Know some of the chemical compounds that we are generating every day in the lab that we are actually putting inside the drain, that sink that goes to the river, to everywhere where there is aquatic life and where even our water is coming from is what we are actually putting there, probably putting ourselves and our lives in danger. And not only that, but we also want to try and see if we can do everything in our power to make sure that we live as safe environment as we can. Without further ado, I will not say much and introduce the speaker for today and for most of the sessions that will be coming through. David Pressler from the US CDC, who is going to give us an overview of what this session and the following sessions are all going to be all about and how we are going to move forward. Over to you, David.
Good morning, everybody. Can everyone see me?
Yeah.
Okay. The only thing I need then is to be able to share my presentation. I have my presentation up. Do I need to do anything to share this? Can everyone see the presentation?
Yes.
Okay, great, great.
No,
Well, good morning.
no,
Hello,
we are not yet seeing the
We are not
presentation,
seeing, we are not seeing it.
You aren't, okay.
Please kindly mute your microphones if you are not speaking.
Anafi, I'm not quite sure. Do I need to share something? Do I need to?
Please share.
Okay. Okay, maybe this is it. Here we go. Now, can you see it?
Yeah.
Yeah.
Yes. Now I
Okay.
see you.
Great. Okay, great. Well, good morning and good afternoon to everybody. We're sorry about the little mix-up with the time frame, but this is going to happen whenever we're trying to start some new things. I really appreciate all of the trouble and effort that Anafi and Charles and everyone associated with the ASLM, LabCoP went through to help us offer this training. So I'm in Atlanta. My name is David Bressler. I'm part of the International Laboratory Branch Biosafety team. Right here in the office that I have here in Atlanta, we've got Shirley Letcher, Thomas Stevens, and Monte Martin. And we are all part of the Health Systems Preparedness Group here in ILB. And what we are trying to do is address the issue of waste management in countries. And we'll start the slideshow now. And what we'll do is I'll try to talk about some of the background and reasons that we decided that this was an important issue and worthwhile starting a laboratory waste management subgroup. So you can see there that the purpose we thought was to bring together the LabCoP country teams and experts in waste management and bring them together for really some strategic thinking about the methods for and options that we all have for building and sustaining a proper and appropriate waste management system in every country that needs it. And as we'll see later, this whole thing is really a global problem. We wanted, as we went through this training, to speak specifically to the growing waste management issues of viral load. And so we are going to focus throughout the training on issues and concerns regarding the upscaling of the viral load testing scheme that we're all going to be involved with probably. So just a quick overview of what our short-term training program is all about. As I mentioned earlier, this is really a collaboration which could not have happened without the express help and assistance of the African Society for Laboratory Medicine, ASLM, and the LabCoP community that they were addressing for all laboratory issues. What we're offering is an awareness training, a short-term awareness training by way of distance learning on the Echo Zoom platform. And we're trying to, again, look at the critical issues of laboratory and healthcare waste management. The key concerns that we all face when we're dealing with healthcare waste, the source, the hazards, and the potential strategies for mitigating, we will talk and discuss as we go along during the next 6 months. We expect that nothing will be able to happen without the involvement and engagement of the countries and their leadership, the MOHs, and everyone really with an interest in preventing and sort of trying to deal with the issues of waste management. And we, during this whole training period, we'd like to encourage very outside the box thinking, really. I do not think that it can happen without some putting some mental effort into trying to find unique ways to solve this problem. So what we came up with was basically a monthly 1-hour learning session. We'll do this over a 6-month period, and as we go along, we hope to develop some resources. Mainly the trainings that we're doing will be collected. The PowerPoints will be available. The recordings of the Zoom sessions will be available, and we'll also have probably be able to offer a few resources that we think will be a valuable addition to the lab folks out there. So just to cover this session, what I intend to do is present an overview of the waste management situation. We'll focus a little bit on viral load waste management. That will increase as we go through the trainings. We'll have a review of the country's current waste management practices. And this information is based on responses that we received to an earlier waste management introductory session that we did to the full LabCoP group back in November of 2018. And all of those responses were collected by ASLM. We'll also talk about the general waste management assumptions and things going forward, ways to deal with it. We'll talk about some of the resources that we will cover. And as a preview, we'll just talk very quickly about the WHO guidance on safe management of wastes. So with that, we'll go ahead and get started. Obviously, hazardous waste and hazardous wet medical waste is really a global problem. It represents a significant hazard to a significant public health concern. And really, if we don't manage it correctly, right now it will represent not only a huge public health issue for those of us who have to deal with it, but also our children and the generations to come. This is not just caused by waste management. Technology has increased, and with technology comes waste, unfortunately. We all create it. With the technologies that we are using to perform viral load, we've got new platforms, and you can see down there I did put in a couple examples of the Gene Expert cartridges and things like that. These all contribute to the waste issue that we have out there. So in the beginning, we'll talk about the healthcare related waste, and we'll just kind of touch on what we're talking about when we say healthcare waste. I took some facts from the WHO regarding medical waste and just a few definitions. Healthcare waste includes all the waste generated within a healthcare facility. We may be talking about the laboratory, we may be talking about the maternity ward, we may be talking about the emergency room. All of those areas within the facility contribute to the issue of medical waste. Really, the total amount of waste generated by healthcare activities, about 85% of that is just general waste. It's not particularly hazardous. It amounts to paper waste, clean plastics, and things like that. It's only that remaining 15% that is considered to be hazardous material, and that may be infectious, toxic, or radioactive material. For instance, if we're talking about sharps, every year there's an estimated 16 billion injections. That was WHO's claim. That's an astonishing number to me, but 16 billion injections administered worldwide. Unfortunately, not all of those needles and syringes are segregated properly. So they go into the general waste pile. And we've all seen this on our lab audits and things like that, that the waste gets put into a dump pile. Maybe that dump pile is scheduled for collection, but maybe it's not secured. And we see the poorest of our poor going into that dump pile to find things that they can use, and they're getting hurt by the sharps and the needles that weren't properly disposed of. When we talk about mitigating this healthcare waste, we often resort to things like burning and incineration. But if these processes aren't done correctly, it results in the liberation of dioxins and furans and other chemicals that are particularly nasty and have a long half-life in the environment. And they may have other health consequences that we don't particularly realize at this point in time. So it's really up to us, those of us who know something about waste, to determine safe and environmentally sound management techniques to mitigate all of the things that we're talking about. Because if we don't, this waste is going to accumulate. It's going to accumulate in the wrong places. As it sits in the environment, it starts to release biological hazards, maybe infectious organisms. It may contribute to the formation of drug-resistant microorganisms. It certainly contributes to degradation of the environment and all sorts of things. So we're trying to protect those of us who work with these materials, as well as the healthcare folks, the patients, the health workers, the sanitation people, as well as overall the general public. So I just pulled out one of the tables from the WHO Bluebook, and which we'll talk about later. And I wanted to give an example of some of the things we're talking about. So this is examples of healthcare waste from different sources. Specifically, we're talking about the medical ward, the laboratory, and the environmental services associated with those facilities. So for the medical ward, we could be looking at sharps, infectious pathological waste, chemical, pharmaceutical, and cytotoxic waste, as well as what we talked about, the non-hazardous or general waste. So the medical ward would produce sharps amounting to probably needles, intravenous kits, broken vials, broken glass vials and ampules of medicine perhaps. For the infectious and pathological waste, we'd be talking about dressings, bandages, gauze and cotton contaminated with blood or bodily fluids, used gloves and maybe masks that are contaminated with blood or bodily fluids. For the chemical waste, we would probably be talking about things like broken thermometers, those things that contain mercury, blood pressure gauges, even spilled medicine and spent disinfectant. For non-hazardous or general waste, the obvious thing would be the large amounts of paper waste, clean plastics, food scraps, empty saline bottles, and that sort of thing. Now for the laboratory, which most of us would be involved with, we'd be talking about things like needles, broken glass, petri dishes perhaps, slides, broken cover slips, broken pipettes, along with our samples and specimens that we would use. Maybe there are blood and bodily fluids for the infectious and pathological waste, our microbiological cultures and stocks, tissue, infected animal carcasses, tubes, containers, and other things contaminated with blood, bodily fluids. For the chemical waste, we may be talking about fixatives, formalin, xylene, toluene, methanol, those sorts of things, and even the lab thermometers. And we also, as we all know, we produce just as much packaging and paper waste as anyone else. For the environmental services, we're probably talking about mostly broken glass, but disinfectants, used disinfectants and cleaning supplies, pesticides, that sort of thing, and as always, the packaging and clean general waste. So major sources of healthcare waste are obviously hospitals and other health facilities, laboratories, research centers. We're even talking about mortuary and autopsy centers, animal research, blood banks, nursing homes. You know, one of the biggest issues is that healthcare waste is often not segregated properly, meaning it's not put into the proper places that it needs to go. This contributes to that little problem I talked about earlier with the children getting into the waste piles and maybe getting hurt. So just a quick review of what we're talking about. Infectious waste would be waste contaminated with blood or other bodily fluids, the cultures, waste, and those items that we may need in the laboratories to do our work. Pathological waste would be human tissues, organs, fluids, body parts, and other things like contaminated animal carcasses. When we're talking sharps waste, we may be talking about broken glass, disposable scalpels and blades, as well as syringes and needles, obviously. Chemical waste would include the solvents and reagents used in the laboratories, disinfectants and sterilants, maybe the heavy metals, like the mercury and things in the components of batteries. Pharmaceutical waste would include the expired and unused contaminated drugs and vaccines. Cytotoxic waste means those things, substances that have genotoxic properties, which are highly mutagenic or teratogenic and potentially carcinogenic. Drugs that are used to treat cancer patients and things like that. Radioactive waste isn't such a big problem anymore. Most people have gotten away from that, but right now that material is still used in some locations. So we're talking about radioactive diagnostic material or radiotherapeutic materials. And in addition to all of that, the non-hazardous general waste. So if we're going to focus on things like viral load, it's time to talk about what we're looking at specifically. I went back to some of the earlier materials that we used in our original introductory session with the LabCoP. What I wanted to bring to light was that, you know, as we go forward with the viral load scale up, we're talking about 40 countries that are involved in this at least. We expect that by 2020, there will be more than 30 million HIV viral load tests being performed globally. That means a concomitant increase in the amount of waste that we're seeing right now. Now, I don't know whether that timeline is still correct, but I think the important thing to take from that is that we will see a substantial increase in the amount of viral load waste coming from our laboratories. Most of the, I'm not going to get into too much about the liquid effluent, but suffice it to say we're producing approximately 1 million liters of the effluent chemical waste right now, and over 2 million kilograms of solid waste. If we're looking at the facilities that we mainly conduct viral load testing in, we're talking about those countries that are low to middle income mainly. And generally the countries have very little infrastructure and very little funds or opportunities to provide to support proper waste management. And so obviously, again, this really poses a great problem and a significant threat to the public health and the environment. Some of the issues that we've looked at with viral load are the fact that during the diagnostic testing, some of the reagents that we're using for viral load, in particular something called guanidinium thiocyanate or guanidinium isothiocyanate, we suspect is toxic. Obviously, it contains a cyanide component to it, binded to a sulfur group. So the problem is right now we don't really have an idea of really how toxic. Folks that I've talked to believe that actually the thiocyanate gets metabolized fairly quickly. The unfortunate thing is we don't know a whole lot about the health or the toxicity associated with the thiocyanate group. But what we do know is that this is coming out in the waste, the liquid waste that we're using that's coming out of our viral load platforms. And the thing is, we do not want it to be poured down the drain because it could be polluting our groundwaters and harming the aquatic life, and eventually could come back to haunt our further generations. One of the immediate effects of using guanidinium isothiocyanate is that if you mix it with bleach, which is a common disinfectant, it releases cyanide gas. So that's just one thing to keep in mind if we're talking about the viral load waste. We need to figure out a solution, and we need to kind of figure it out fairly quickly. So I already covered this a little bit, country challenges, lack of country-specific waste management regulations and guidelines. There are, again, limited funding and limited human resources and people knowledgeable about the situations in many cases. There's a lack of technology and infrastructure advancement for mitigation, or at least strategies that are common and not requiring a lot of funding to introduce, and those things are lacking. And so I would say that that's something else we need to work on. Obviously, there's a shortage of local waste management technical expertise, and you know, all of this contributes to wanting to get rid of the waste that we have fairly quickly. And what's the solution to that? Apparently the solution to pollution is dilution. And that is washing most of our viral load waste down the sink. But do we want to do that? No, obviously we don't. We don't know whether that contributes to, you know, to our groundwater pollution or not. But suffice it to say, it probably doesn't do it any good. So we want to try to avoid that if we can. So how do we address the situation? Well, in this case, what we've taken the tack for this training is that we want to bring the awareness up of waste management in general. We want to try to identify effective solutions, sustainable solutions, or options that may be out there, or maybe thinking again outside the box. What can we do with what we have? We need all of these things to come together. We need the brain power that's out there to come together and find a way to reduce this public health threat that's continually increasing. We obviously understand that countries may require assistance on waste management, and hopefully this will contribute to, in some way, bringing that up. So one of the things I wanted to get to before we end is a review of the responses that we got back from that first waste management LabCoP session back in November. We put out a country-specific waste management survey, and what we did was we sent out 6 questions. We presented to the attendees on the LabCoP, and we put 6 questions out on waste management, what the status was in the country. We wanted to see what the situation was from the folks who would respond. Each question did contain a list of multiple choice questions, but it also contained an open field text box for more detailed answers. The responses, as I mentioned, were all collected by ASLM, and we had a chance to go through them and see what most of what we heard back from the countries was. So I'll just give you a list of the questions along with what the options were. The first question was, what type of wastes are collected, transported, and disposed of at PEPFAR-supported testing facilities? And there, it just runs down the same list of types of waste that I already went through. Question number two was, what treatment technologies for hazardous waste are currently available at the PEPFAR-supported testing facilities? Circle all that apply. And we had a list, whether it was burn pits, chemical treatment, dry heat, encapsulation, microwave, steam treatment, or thermal treatment. Number 3 was, how many viral load testing facilities are PEPFAR supported? None. 1 to 5, 6 to 10, 11 to 20, 21 to 50, or more than 50. Number 4 was, how is liquid chemical waste from the viral load testing platforms currently being disposed of at PEPFAR supported testing facilities? And we gave options. These are more mitigation strategies, which we'll talk about in later sessions. One of the first was encapsulation, which is filling containers with liquid waste and then immobilizing them in concrete or something like that after the containers are sealed. We added the answer poured down the sink, obviously, just to see what we would get. Another treatment strategy was thermal treatment. Is the material incinerated? We wanted to know whether people were aware of it, so we put in don't know, not applicable, and are there any other methods out there? For the final 2 questions, are there what national regulations and policies that regulate treatment, storage, disposal of hazardous waste? Yes, no, or don't know. And number 6, the final question, are there regulatory bodies that enforce these national regulations policy for the treatment, storage, and disposal of hazardous waste? So here we have the results, and all we did was really sort of tally them up, see who answered what. Now we got responses from, we sent them out, I think, to 10 countries, and we got responses from 6 countries. Some of the responses didn't come back complete, so we sort of had to estimate what the responses were or drop them completely, but we got responses back from Malawi, Tanzania, South Africa, Uganda, Zambia, and Ethiopia. So for number 1, you can see that what we got was responses back that the chemical waste, the infectious waste, non-hazardous or general waste, and sharps waste really was what the biggest sources of waste were for these folks. It appears that from question number 2 that thermal treatment was the most acceptable treatment, and again, this is either incineration or treatment in some form of heat. Question number 3, how many viral load testing facilities are PEPFAR supported? We had a pretty consistent answer with that. There was consensus that basically most countries had about 11 to 20 viral load facilities being supported. And now for the kicker here, how is liquid chemical waste from viral load testing forms currently being disposed of at these PEPFAR-supported testing facilities. And pretty much it told us that basically all of the waste from viral load is being poured down the sink. Now, is that the answer we want? No. We want to make sure that we're talking about other ways and strategies to mitigate that viral load waste. Now, the last two questions, 5 and 6, are there current national regulations and policies in place? Most countries said yes. One country said no. Are there regulatory bodies that enforce these national regulations and policies for the treatment, storage, and disposal of hazardous waste? Most countries said yes. And there was one country that said that there were national regulations in place, but also said that they weren't aware of anyone that enforced those policies. So that was the responses that we got back. And so there are some things that we have and can set as a baseline. We really do want to do something about the most obvious issues. We want to figure out ways that we can deal with the chemical waste, the infectious waste, the sharps waste especially. And we want to figure out a way to help countries assess their situation and not pour their chemical waste down the sink. So one of the things that we'll be talking about, that we'll talk about especially next session, is the WHO publication, Safe Management of Waste from Healthcare Activities. It's in the 2nd edition. It was first published in 2014. This is WHO's best guidance on healthcare waste of all types. So you can see what the chapters cover. I'm going to skip over that for time's sake right now. But just keep in mind that we will be spending more time in the next session looking and reviewing this document, which offers really some very helpful information, ways to move your program forward as far as addressing the situation of waste management. Does it address viral load waste particularly? No, but it does talk about ways to deal with chemical liquid waste in particular. So those are, we're gonna look to the WHO and try to see what we can do about our own laboratory waste situation. Okay, so in order to wrap this up a little bit, there is a little bit of homework for everyone. I really appreciate the involvement that I see that we have on this call. But again, this movement forward with waste management will not happen without country involvement, without moving and marshaling funds to help with this situation. We can't do it here at CDC. We have no funding to assist with this, so we have to rely on the countries to take the lead in this. And this is the reason for this LabCoP subgroup. We want to provide information, get the awareness out there to the people that hopefully we have on the calls that are particularly interested in dealing with this and may have knowledge that we don't have here at CDC about the specifics in their own country. So we need involvement from you. We need you to ask questions to help us out with this. So we will review the WHO Bluebook. And I provided the link there. We're going to specifically look at chapters 1 through 3, chapter 7, and chapter 8. But we will also focus on viral load waste management. What I would like everyone to do is take a look at that link and review the WHO Bluebook, and we will talk about and discuss it next time. So next month and beyond, what we have planned for this training, this short-term training, we want to review the current best practices and guidance from WHO on waste management. We'll do that by looking at the Bluebook. We will have country presentations from countries that are beginning to expand their efforts to deal with viral load waste management expectations. We hope to have a special speaker regarding one country's experiences on dealing with viral load waste. We also have to hope to have country presentations on their own experiences in developing the waste management best practices, and maybe hear from countries' personnel that may have introduced the issue and we want to hear what they found out. We also, as I mentioned, want to brainstorm on awareness and bringing stakeholders into the mix and engaging them. And we expect to, excuse me, put out a checklist dealing with viral load waste management, excuse me. And we hope to review the project progress, and we'll follow up on that assessment. And hopefully at the end of this training, we'll be able to demonstrate improvement in at least a couple countries based on the trainings that we're offering. With that, I think that's just a review of what you should take a look at for the next time. Here are some references and resources that I put together for you to review for next time. We're hoping to get some more involvement, but one of the things I did do is I sent an email to Anafi to share 2 questions that we hope to get answers back by way of the Zoom chat. And these are questions that are basically taken from the same survey that we put out originally in November. So just 2 questions this time. We want to see what your answers are, and we hope to use that to assess and provide feedback to you as an entire group. With that, I thank everyone at ASLM. I thank the LabCoP group. I think at this point I can put out for questions, but I think, Shirley, is there anything that we want to add on to this?
Yeah, I think just one thing, I don't have to. We set as a goal as ILB to the International Lab Branch to improve the viral load waste management practices by the end of September of at least 3 countries. For that to take place, and I think you heard from David, primarily what we can offer is technical assistance, because at this time there isn't a pocket of funds to deal with the issue, but technical expertise and in-country engagement should be enough to improve waste management practices to some degree. So we would like to, we know that there are multiple countries on the line. I can see a lot of names, can't tell where everybody is from, but we would like to offer for you all, to the countries who want us to engage more closely with them and directly with them over this time period, to please send an email to Anafi, copy Dave as well. And we will work with you more closely, not just having the monthly sessions, but find out more in depth what is going on in your country with waste management practices for viral load, and help you move the needle forward to improve it. So if you would like to volunteer to be one of those countries that you want us to work more closely with, please send that email. In addition, we will be preparing also a 1-pager that will outline what are the most appropriate ways to handle viral load waste. And so that will be forthcoming as well. And we'll be working with our partners, collaborating with Global Fund and others on that endeavor. So with that said, I'll turn it back over to Dave.
Okay. If there are any questions, I'm going to let you know that I am not a waste management expert. I am a biosafety professional here in ILB, but we think that this is probably something we can bring together most of the people that we know should be involved in this. My hope is that if I can't answer a question, that there will be people on these calls and subsequent calls that will be able to answer more from the country perspective if I can't, or whoever's here cannot answer the question. So with that,
okay. Can I would like to start with a question. My name is Bingi Tusime, and I would like to thank you for this arrangement and a very good presentation. So waste management.
If I could ask what country?
I'm based in the US.
Oh, okay.
At the moment. So I would like to actually add on top of all the good intentions that we have for control of waste in more especially developing countries. I mean, I would like to put my voice that you probably know that a lot has already been done in this field of waste management in countries, things like surveys, people putting together documents, involvement of governments, and so forth and so forth. But in the interventions that I saw in the presentation today, I think we're lacking one of the biggest player who is actually the manufacturers of these wastes. So involving countries, that has, I mean, I've been involved in a couple of these activities. Good work is done, but sustainability becomes a problem because there's probably no government funding or a partner who is willing to take on this activity forever. So my only request, and I think something that we can add on most of the documents going forward, is to task the manufacturers of these drugs, of these reagents, of these biochemicals, whatever it is, to actually start taking responsibility of being able to play part in reducing and intervening in this waste management. Thank you.
I certainly agree with that. Thank you for that idea. This is something that we have known about, and we agree that nothing will happen without the engagement of the manufacturers. We have some people here right now in the office that have engaged some of those manufacturers, and we certainly agree with that. I know that IDC is probably working on some of those issues as we speak. This is a big deal, and we know that the manufacturers probably won't be involved with it unless there is a monetary reason for them to do this. And so that is something I would present as a challenge to the group, is that we need to come up with ideas to make it monetarily worthwhile for the manufacturers to be involved in this activity.
Yeah, this is Shirley. The manufacturers have been approached more than once and multiple times, and they also were, I think, present at the ASLM meeting where we discussed waste management practices. In reaching out to the manufacturers, I can't say that there has been extremely positive response except from one manufacturer, and that is Roche. And so, moving forward, those discussions will take place with the manufacturer who's agreed to actually try to address target the issue with us. So it will take it's not going to be the approach to waste management is not going to be in a silo with just one organization doing it, but it will be, broadly an international response, and also will require the engagement of the manufacturers. So just so that you all are aware, it's not that those discussions have not been had, and they've been had multiple times with manufacturers. Right now, as far as a positive response, the positive response is only coming from Roche. So,
yeah, sorry, I just need to chip in a little bit here. I think the easiest way to do that is to involve them right from the point of procurement. I mean, when you sign contracts with the manufacturers, let that be included in the contracts. Like you have issues stipulating things like maintenance of equipment, blah, blah, blah. So that needs to come in strongly so that they know if we don't commit to controlling waste, then we don't sell.
Okay, so right now, as far as PEPFAR is concerned, PEPFAR is renegotiating contracts with manufacturers, but for an all-inclusive price agreement that will be able to be one price for all PEPFAR countries, and that's something that's moving forward and will take place within the next coming months. regarding the viral load waste, it's not that anyone knows specifically. The solutions are not going to be a one-size-fits-all for that, and they have left it up. If you look at your package inserts, it's as per country guidance. So that is not going to be something that, you know, PEPFAR is going to be including within that agreement, and we can't even say for sure that we know the best solution for every country. So it's up to each country to try to tackle this issue, and I think the international partners will work with you. But even for the solutions in country, that's going to require Ministry of Health buy-in, perhaps Ministry of Finance, and, you know, the other stakeholders that are involved in country. And I can say that I know that PEPFAR is willing to work alongside of, and in addition, Global Fund, because we've had conversations with them, because everyone realizes that this is a problem. But we're not, so that's just not likely to happen, but we will be engaging them.
Thank you.
Thank you. Are there any other questions?
Thank you, David. Let me just say we kindly ask people to put questions in the chat box, and we can take them in that order. Nicholas will be reading out the questions as he's preparing. I just want to mention that I think it's an important point on manufacturers has been mentioned, and indeed there are efforts like Shelley has mentioned also through the integrated diagnostics. So I think it's movements like these that will see us really making concrete work plans, which we are trying to do, and systematically follow these issues. Nicholas, are you ready with the questions from the chat box?
Okay.
I remember the first concern was from Kate, England.
Okay, thank you very much.
Before you go, there are those two questions that have been mentioned by David. Kindly also include your responses from a country perspective to those two questions. Thank you. Over to you, Nicholas.
Okay, thank you very much. The first one is from Kengland, and this is a comment. He's saying, great, thanks for this. Good to offer technical assistance for this, and we need to raise funds for this global issue. I think David will highlight more on raising funds for this. Then Amdasu is just thanking everyone. Then Ambushet is also thanking everyone for engaging them in a valuable discussion. Then this is Sebonego, and he's asking why is solid viral load waste not included? Why is the solid viral load waste not included? I don't know whether you're getting the question. And then, okay, thank you very much for the correction, Dr. Chais. Why is solid viral load waste not included? I think we made a typing error. It has to be solid viral load waste not included. And then this is Rafael, just thanking you for the great presentation. And most of the comments are thanks. Maybe you could first answer those, and then we shall read out the others more.
Okay, could you repeat the first question?
Okay, the first question, he was just commenting that we need to raise the funds for this global issue.
Right. And so just to address that, one of the things that we plan on talking about during the next 6 months is engaging partners. And engaging those stakeholders that may see this issue as a big problem and may be willing to either donate funds or something like that, or donate resources to the country. So we're going to hopefully garner some ideas about engaging stakeholders, and what that leads to, we're leaving it really up to the country to work out, but we're hoping to offer some ideas for bringing stakeholders into the mix, and what that leads to, again, could be resources that the country. Let's see. So to address the issue about excuse me, to address the issue of solid viral load waste that is a component of this. And that was one of the reasons that I put the examples of the GeneXpert cartridges in that picture set. But we haven't kept that out of the mix. It's just that right now the viral load mix represents one of the biggest aspects of this. Certainly as we go forward, we want to hear about what your experiences are. You know, one of the things that we also didn't include right up front was the issue of point of care and the waste that's generated from point of care. As we move these platforms out to the field with the PEMA system and things like that, they are certainly generating waste contents as well. So we hope to talk about and address a lot of these things that you're bringing up as we go forward in the next 6 months. This again is an introductory session, but please, I guess what I would request is in answers, when we get answers, if you could answer from, as Shirley mentioned, answer from the country perspective, but also provide some information about what you may have tried, some of the ideas that you have brought up, or what you want to see come out of these situations. And maybe what we can do is present that as we go on in these sessions and use that as a springboard to developing ideas that will help us out with those things. But yeah, certainly the solid waste and point of care waste is something else that needs to be certainly addressed, and we're going to try to do that.
Okay, the other question is from Dr. Chais, and is asking, what particularly are you going to do with the 3 focus countries besides the training sessions? What particularly are you going to do with the 3 focus countries besides the training sessions?
So we would start with the point of need. You know, first of all, we need to make sure that those countries, and again, it doesn't have to be, we're asking for volunteers. So we're not picking, you all are deciding that you want to engage. So we require strong country buy-in, commitment on the part of the Ministry of Health. We would engage the CDC laboratory advisor and all of those in waste management for viral load that are relevant, and that you all would need to be committed to move forward. First thing would be like, does your country have a policy? So if you have agreement that you want to move forward with it and you don't have policies in place, we could help in terms of helping you develop the policies. And then for whatever specifically that you're doing with the waste now, educate us on that way going forward. And then we can propose possible solutions based on your particular scenario.
One of the ways that we want to do this is by bringing in countries that may already have a program in place, and we want to hear their experiences, and if they have something that's sustainable and being used successfully, we look at this as a forum to get that information out to other countries. And maybe this is something to be looked at as a twinning process, that we have a laboratory or a country that already has the waste management processes and policies in place and are utilizing those successfully, and maybe they can then help out other countries that may be needing some assistance or maybe needing some advice and consultation as to how to move their programs forward.
And we would also engage other donor organizations and other partners so that it's a collaborative process to help that country.
Okay, thank you very much. There are so many questions in the chat, but due to time, I think I'm going to hand over to the moderator. But before handing over, we have created a WhatsApp group for these trainings. Please kindly send messages to the WhatsApp number that you're seeing in the chat text so that you may be added to the group. All these questions are going to be put in the group, and David and Sheila and also other subject matter experts will be added into the group so that your questions are answered. And also this group is going to be used to share materials from the trainings easily. Thank you very much. Back to you, moderator.
Thank you very much, Nicholas, and thank you everyone for participating. It's quite a high turnout indeed. And this is testimony to the fact that this is an important subject that we really have to take seriously. And so kudos to all of us. I just want to reiterate that today's session was really to just break the ice and get to know whether people are really interested in this. And I think there is no prize for guessing that indeed this is something that we all want to do. So we all urge you to continue, I think, to take the consecutive sessions that will become more and more specific as we move on. As David mentioned, we are going to have, we're going to dwell more into the Bluebook, which is the guidance from WHO. After that, I think we'll talk about issues of training, waste management training at country level. For without that, I think we may not move much forward. Training only may not be enough. We are going to talk about what strategies are out there, and we want this to be as practical as possible. And we will be bringing, I think, country examples as well. And we also urge you to come forward with and volunteer as it's been requested. And I think lastly, I think the issues of policy. We know, I think we are in this situation because there is not much that we have done in terms of policy. And we would want us to move together and learn from each other. As ASLM, I think we exist to advance the profession of laboratory medicine. So we are eager and will always work tirelessly to provide these platforms where we can learn from each other, bring all the subject matter experts, and get to learn what is in the south and what is in the north, and mix these. Probably they all meet in the central part of the world, and likewise. So without, I think, much, I think we are planning to have our next formal session on the April the 9th, after which we will be having these after every, more like 30 days. I think we will be doing this within the first 10 days of every month. We will be compiling all the questions and the concerns that have been raised in the chat box and send you by email or by WhatsApp to try and make sure that we have answered, I think, as many concerns as possible. Please feel free to even send the responses to the questions that have been put in the chat box to us. And for those that we are participating as country teams in a group, kindly send us the names of the participants that were in today's meeting. And we hope to meet you, I think, again in a couple of days. And we are seeing ourselves as a family for the next couple of months, 6 months. But this is just starting. We certainly want to continue this beyond the 6 months. There were concerns about whether we are limiting to a certain number of countries. But I think as you continue coming into the next sessions, you realize, I think we will try to make a way forward together. With this, I certainly want to thank you for very huge attendance, and apologies again for the mix-up in time. And we hope to do better in the next sessions. Thank you. Bye.
Thanks.
Thanks, everyone. Bye-bye.
Thank you very much. Kwaheri.
Thanks, and kwaheri.
Okay, what am I mentioning?
You are saying goodbye in the local languages.
Bye. Thank you, everybody.
Thank you very much.
Thank you.